All right. So like I said, hopefully more people join us, but when they do, they can file in and we can go over some information. So I'm going to take you through a presentation today, and then after the presentation, you're more than welcome to see me directly, do a posture examination, and even do a little consultation in the back over here, okay? All right, so I'm going to take you through a presentation on how to eliminate pain and improve your health. The presentation will take you through a couple different concepts. Some you may already know, and some you may not know already, okay? All right, so who the heck am I? I'm Dr. Richard Marchetti. I'm from Optimal Spine and Joint Center, otherwise known as Al Amthal here in Oman. I'm originally from America, the state of New Jersey, which is by New York. I practiced in America for about 1.5 years before moving to Singapore. When I was in Singapore, I met Dr. Taryn, who's the other doctor in our clinic from New Zealand. I then ended up going back to America for about another year, and I practiced in Colorado. When I was in Colorado, I worked with one of the probably most prestigious clinics, chiropractic rehabilitation centers in probably America. It's in Colorado. And from there, I went back to Singapore, and I had the opportunity to open the first Chiropractic Biophysics clinic in Singapore, which is, we'll go over that in a minute, what that is. Now, when I was back in Singapore, I had an Omani patient. That Omani patient said, hey, we don't have anything like this in Oman. You guys should check out Oman. So we came to Oman and we decided, yeah, it's a good opportunity. Now, as I understand it, there's 5 chiropractic clinics in Oman, only 5. All 5, other than ourselves, so let's just say 4 of them, do traditional chiropractic care. Okay, so traditional chiropractic care, I'll cover that in a minute, what that will be. We are very different. So what you'll see today is what makes us different, and then I'm going to go over some ergonomic benefits, like how to sit in your desk, how to sit in your chair, how to, when you're sleeping at night, what pillow to use, and things like this. Okay? All right, so like I said, we're going to do a quick overview of chiropractic. How do we get damage in our spine? What is normal for the spine? And how do we get back to that normal? Okay? And then ergonomics for life. Again, you can always go to optimalspinehealth.com or optimalsj.com and get more information. At the end, I'll also promote, and I'll say it now, Optimal SJ, Instagram, Facebook. I do a lot of video. I do a lot of posts as well. Yeah?
Do you post any videos on YouTube?
Yeah.
I think I saw some of the videos.
Yeah.
You look familiar.
Yeah. I'm an internet sensation. What can I say? Yeah, so I do YouTube. I usually the YouTube to Facebook, but if you're directly searching YouTube, maybe. The thing is, like, optimization for YouTube is way different than Facebook and Instagram, so I had just started kind of pushing the channel for YouTube. Like right now I'm filming on YouTube, and then I will edit a little bit. I'll put it up on YouTube, but I'll also put it to Instagram TV, and I'll put it to Facebook directly. All right, so what is chiropractic? Does anybody know this word, by the way, in Oman? No? So a lot of people will type this into YouTube, actually, and they'll get the videos of people getting cracked and popped and clicked, okay? And everybody likes those videos. I should probably do more of them because that's like the fan favorite, okay? But the reality is, chiropractic is a system of healthcare in which we're looking at the spine, okay? Because the spine will affect your overall health, and I'll cover that in a minute. But there's 3 tenets to chiropractic. There's a science, there's a philosophy, and there's an art. So what the heck is that, okay? Well, the science is, I said, spinal health. All right, so our brains control the functions of our body. It does that by communicating through the spinal cord and the spinal nerves, which have to go through the bones of the spine. When the bones of the spine are not moving correctly, they're not feeding the correct information to the spinal cord and into the brain. And also, when they're not moving correctly, it can create damage to that spine, damage to disc tissue and ligament tissue. And that damage over time can also start to really press on nerves. When we get that pressure on the nerves, typically we'll feel that as pain, okay? But it also can affect our overall health, okay? The philosophy, basically of chiropractic is, your body is a self-healing organism. What do I mean by that? It means that if we cut ourselves, the body heals that cut. If we break our arm, the doctor may set the bone so it's straight, but the body will heal that broken bone, correct? So inside us all, we have the ability to do healing. We just need the body to know how to heal, meaning the brain will send the signals. We want it to be as clear a pathway as possible, so we clear that pathway. And then the art. Just a minute ago, I told you there's 5 clinics in Oman, 4 of which do traditional chiropractic. So traditionally, the art is how they're adjusting. Okay? Some people will use a table that drops. We call it a drop table. Some people will use instruments to adjust. Some people will use their hands. And when they use their hands, there's many different systems out there. You brought up YouTube, a very famous video is a kid that walks into a clinic like this.
Yes.
Yeah, and then the guy's adjusting him. Okay, and eventually over a couple period of time, the kid's able to walk and get out of the clinic, right? That's a very famous video. It's out of Australia. And he was doing Gonstead technique. And this manual technique is just in a different format. That's the art. Okay? But most chiropractors will do diversified. What is it, about 80% of the profession does diversified adjusting. Okay? So as I said, the philosophy of chiropractic, the body is a self-healing organism. The nervous system controls and coordinates all the functions of and processes of the body. The structure of your spine, the way it's shaped, will dictate how it works, the function of its spine. Okay? And of course, changes in that structure will affect the nervous system, as I've already spoken about. Okay, so again, the brain controls all the functions of the body. It does that by sending information down the spinal cord, out through the spinal nerves, and those nerves control every function. They control your muscles, they control your joints, but they also control all your organs. When we get mixed messages or blockages of clean messages in the body, it starts to affect not only our pain, which is why most people come to see us, but it also starts to affect our overall function of our health. Okay? So we typically will say, when you have garbage signals going into the brain, we're going to get garbage signals going out of the brain. All right. So most people say, okay, fine, I get it. I can have issues in my spine. How the heck did I even get those issues? And we always say the word trauma. But that word in trauma, I mean, I've been here for 5 years. And I kind of laugh because I'll say, have you had any accidents or injuries? And people go, nope. And they're 60 years old. And I go, I find that very hard to believe that you're 60 and you've never injured yourself one time in your entire life, okay? And of course, some of the types of accidents we'll talk about. Car accidents. Well, I always joke around. In Oman, it's not a big accident unless somebody dies, okay? Yes. That's how it is here, you know? You can say, have you ever had any car accidents? Yanni, small. What is small? We're driving, we lose control, the car flips 5-6 times, but Yanni, we're fine. And went to Hala Hospital, they took x-rays and said nothing's broken, nothing's destroyed on you, so you're fine. That's the way it is here.
Actually, I had that all over 5 months back,
Yeah. And so you'll hear this quite a bit. And, to me, that's a big accident. Somebody said they were in a rollover in America, that's a huge accident. That's a huge accident. Here it's like commonplace, like it just happens and it's all big. It's not a big thing. All right, but of course, we know that they can really affect the shape of our spine. They can really affect our overall health of our spine and also give us pain, okay? Falls. You'll hear about slips and falls. No, I've had many, okay? But I've had guys fall out of date trees. I've had people fall down wells. I've had people kicked by the donkeys. I've had a guy got run over by a goat, okay? I've had a lot of different things in this country, okay? But falls, generally speaking, we'll have somebody, praying, getting ready for prayer. They're washing their feet. And they step and they slip on the tile and they land on their butt and then they get pain from that. And that's really, really common here. Sports injuries. There's only one sporting injury in this country, which is football. Okay? I mean, yeah, we get some people who play badminton and, I get occasional other things like CrossFit now in the country, but mainly it's football injuries. So many knee injuries in this country from football. And then, of course, chronic poor posture. You guys are working inside, you're outside, but you guys may be inside with the computers, things like this. And of course, daily, but then other things that can cause that, right? Other bad postures, the way we sleep, the way we drive our car, and so on and so forth. All right? And then the last one, or maybe it was the first one I should have said, but birth trauma. So again, that 60-year-old who told me they never had problems before, they were born. And in the process of being born, you can actually get trauma to your spine as well. A doctor is allowed to pull up to about 4 kgs of force while pulling the baby out of mom. So if you're supposed to have a curve in your neck and that doctor's pulling on that baby's head, he can definitely affect the neck. So about 83% of babies are born with the curve in their neck. Unfortunately, about 11% are born with a straight neck and about 6% are born with the neck bending in the wrong direction. All right. Now, how does this happen? Again, they can pull really hard, or even the C-sections, right? A lot of C-sections in this country. They cut, they take them, they twist, and they pull to get the baby out, and they can really affect the babies. And sometimes you'll get those babies who can't turn their neck, and they're in quite a bit of pain. Okay?
So these babies they get well after some time, or you need to take them to the doctor? For the baby, you won't know actually.
Yeah, so some of the babies, you'll know they're having problems when they're young, and you know typically they will take them to the doctors, but the MDs don't see it the same way we do, right? So they'll say, oh, just you know, here's a pill or here's something like that. Some babies have digestive issues, right? They get the gas buildup, things like that. They get adjusted and they start to feel a bit better. There's a big controversy right now going on in Australia. Should babies be adjusted? You know, they're like anti this adjusting babies. We don't do it a lot here. It's not like a big thing. But I have a kid right now, I think he's 3 months old, and he has torticollis. He can't turn his neck. So I don't know when he was getting born or just it happened when he was sleeping later on, but he was in his, they're Ukrainian, half Ukrainian, half Lebanese. Half Ukrainian, half Lebanese. And you know, the baby was in the Ukraine. They did physiotherapy on him. And now he's here with us getting physiotherapy and some light chiropractic care. So do babies need it? Sure, right? When they need it, they need it. Do we have to see every baby? No. But if my patients want their babies to be checked, we'll check them, right?
But sorry, how will I know if my baby is having this issue?
You don't.
I won't know when, yeah?
You don't, other than maybe the symptoms of pain. Yeah, other symptoms, yeah, crying, not being able to turn their head, maybe not wanting to feed. You know, you want to feed on one side and the baby can't turn. So then the mom's always feeding on one side over the other because it doesn't like to turn to one side. Well, that's a sign that the baby can't turn his neck, right? All right, like I said, gas and distension of the bowels, things like that. Those are all different symptoms. There was a study that went on, I can't remember the year and I can't remember what journal it was, but there's a condition called SIDS, and I don't know if anybody knows about SIDS in this country or they've ever heard it before. Sudden Infant Death Syndrome. Okay, that's what it stands for. And you have a baby and it's like a few months old, and then you go to the crib and he's dead. And people go, what is that from? Like, you know, why did he die? That they did an autopsy. I think it was 11 babies. So it's a very small population, very small sample size, but 11 babies, and they did an autopsy, and all of them had the first bone here, called the atlas, was flexed like this. Every one of them, all 11. We know that the upper neck and the brainstem are involved in breathing centers. Okay, so if the upper neck is constantly in flexion, it could be affecting these babies' breathing. So maybe these kids had kyphosis in their neck. Maybe that's just 6%. Maybe we don't see too many of these because they don't make it past young birth age, you know? So these are things we don't know. But the ultimate problem is to know this, you would have to take an x-ray. How many parents want to give their newborn an x-ray? Not a lot, right? How many medical professionals are okay with giving a newborn an x-ray? A lot of them are not. I don't have a problem with it because I know x-ray is not that dangerous, but in the grand scheme of things, the general population, that's a big problem for most people. They don't want to x-ray a baby. Okay?
Sorry, another question.
Sure.
If the baby has this curve, the last one,
Yep.
is it meaning that the head will be always down? We can say that is a sign?
Probably you'd be seeing that positioning, you know, like the baby kind of stuck like this, but it's kind of hard to tell because most babies are kind of bobble-headed anyway. They don't have a lot of neck strength here to hold their neck up. So it'd be difficult to say that this would look different on the outside than this one here. Does that make sense? Yeah. It's hard, it's really hard to say without an x-ray. So as I said, traumas, some car accidents, slips, and falls. And then, like I said, the chronic poor posture ones, things like the way we sit at our computers, the way we're using our cell phones today, the way we're sleeping, driving your car. Now, come on, this isn't Omani drivers. We'll get to that later. That's my favorite topic. Okay. The way we ride our bicycles, maybe, the way we pick up boxes and lift items, the way maybe we're reading in bed or using our computers in bed. Computers. And again, these pictures are kind of old, right? Who has monitors like this anymore? Who uses corded phones? Okay, corded phones. And of course, using the couch, sleeping on the couch. So these are different repetitive things we might do daily that lead to problems later on. All right, so we're going to go over what normal is. So there's two ways I look at normal. There's a normal posture is what we see on the outside. You may hear that term quite a bit. In Arabic, there's no such word as posture. It's like the way we stand. Like the terminology is how you stand or the way we stand. But I always talk about the way we stand on the outside and then the structure on the inside. Because I've seen people look perfect on the outside this way, but then have an abnormal structure on the inside. Okay? So when we look at somebody from the front, and again, we'll do this, we can do this each and every one of you at the end if you want. We're going to pick a center point between your feet. That center point between your feet should match a center point in your knees. That should match a center point in your hips. Your hips should be nice and level. We should be able to pick a center point in the bone of the spine here, draw it straight through the center of the spine. The shoulders should be level, through the neck, and then through the skull, and the ears should be level. Okay, and everybody kind of understands that we're supposed to be straight from the front. We shouldn't be all shifted out of alignment. From the side, the ankle should match the knee, should it match the hip, should it match the shoulder, and then should match the ear. And again, most people understand that you're supposed to be straight from the side. Most people think they're straight from the side, but most people are standing like this today, unfortunately. Okay? So as I said, we have that normal outside posture, and then we have a structure that's normal. So the same way we're supposed to have a normal blood pressure, a normal cholesterol level, normal blood sugar level, a normal body temperature, there's a normal shape to our spine as well. Okay? In your neck, it should be a piece of a circle. So it has that curvature like this. Okay? And that circle curve should be ideally 42 degrees. It will average about 34 degrees. And research came out that said about people that were 30 degrees and above, 96% of them were pain-free. So in our office, if you fall within this parameters, okay, about this normal model is about 73% of the population, so it's not everybody, all right? But so if you fall within the normal parameters here, we're trying to get you above 30 degrees because that's what the research says is a pain-free range of motion area, okay? In the middle back, it's a piece of an oval or ellipse. From T3 to T10 will be 37 degrees, T1 to T12, 44 degrees. Why is there different measurements? Because most of you guys are a little shorter, we can see it all, but for me, they'll probably miss some of it. They won't be able to catch it all, so we can see like T3 to T10 a lot easier, okay? And then some guys are very, very thick, and you can't get through all this and see T1 very, very clearly. And then lower back, also a piece of an oval or ellipse, ideal curve 40 degrees, average to curve 39 degrees, and then again, pain research has said above 36 degrees is your pain cutoff. Okay, so people below 36 degrees tend to have more pain than people above 36 degrees. So in my office, we would always try to get you above that 36 degree mark, all right? Those curves, again, stack on top of one another, so we should be able to draw a line and hit certain vertebra. All right, this would denote whether we're offline or online. Now, there's a lot of research that people above the age of 65, the further they get off this line, the more problems they have, the more pain they have, and the more trouble they have, like going from a sitting position to a standing position to a walking position. It's called the get up and go test. Okay? Because people who are off this line, you know who I'm talking about. Right? They have pain, they have disability, they're very slow. Their gravity is placed in front of them. They have a greater likelihood of falling over and breaking something at a later age. So we said this is probably the most common posture that we see today. You know what I'm talking about because you'll see your friends from the side and they're all standing like this. And why? They're on their phones. Okay. Now, there's two parts to this. There's just the neck going forward, which you'll see some people, they look great from here, 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 but their necks are like this. And then you'll see some people who have the full thing. All right. So the full posture kind of drives this. So it may have started from this or it may not have. Okay, so some people, they lose the strength of their stomach here. They lose strength in their butt here. And they also get the big Mandy meat Omani rice belly. Okay? And what happens is they get the big belly, so they all this weight up front and they have to change that, right? They have to adapt to that weight. So the weight goes forward, they have to lean back. So as they lean back to adapt to that weight, their hips get shoved forward. As this posture goes, it pushes the head forward. Now we couple this posture with cell phone use, and computer use, and it looks really bad. Yeah? So this posture on its own, you'll see it creates headaches. It can create, obviously, neck pain. TMJ means jaw pain. Okay? Arm pain. Maybe stiffness of the spine, so that arthritis of the joints where the joints are real stiff and you can't turn as well. Okay? Thoracic outlet syndrome. This is when, because we're like this, all this musculature gets very, very tight and it starts to affect the blood flow down our arms, so we get pain or numbness and tingling. So some people think it's the neck, but that's not always the neck. It can also come from the musculature here. Okay? Spinal cords get stretched. Ligaments or arbata get stretched and deformed. Muscle spasm, obviously, and then even disc problems. Okay, so when we take an x-ray, this is what it's supposed to look like. This is the normal curve of the spine. What this is showing is the weight of the skull here, which is about 3, 4, 5 kg, depending on somebody's head size. Okay, it's supposed to go down the back of the joint, down the back of the disc, and open the disc in the front. But what happens when you have that forward head posture and you have it for a long period of time, the weight now gets dispersed down the front. And that weight over time will start to compress the disc, change the bone shape, we start to get damage to the joints. So here the doctor will tell the person that you'll have spondylosis in your neck. You'll hear that a lot. And I always joke around because patients come to me, oh, my doctor told me I have spondylosis in my neck. He told me it's because I'm getting old. And I say, oh, okay. We take an x-ray and it looks like this. The red line is that person, the black line is normal, right? It looks like this, and I say, yep, you have a lot of damage in your neck. Yes, my doctor told me I have spondylosis in my neck. He told me it's because I'm getting old. And I go, okay. And then we get to their lower back, and their lower back looks perfect. It looks like this. I go, how old is your lower back? And they go, huh? I go, how old is your lower back? And they go, well, it's the same age. I go, oh, I'm sorry, I thought you were getting old. You know? What do you mean? The doctor said you have damage in your neck because you're getting old. Why doesn't your lower back have damage? Huh. I don't know. And I was like, because the weight was going correct through your lower back joints and incorrect through your neck joints for a long period of time. Okay. So, again, we look at the posture and how somebody stands from the front because it's like a x-ray box without having x-rays. So if we see a person is shifting to one side, we know that their spine is also going to be shifting on the inside. So if they're crooked on the outside, they're going to be crooked on the inside here. Okay? And when I check one of you today, you'll most likely have one of these postures for sure. Okay? And then the same thing. This is what we expect to see when we take that x-ray. It would look something like this.
This is normal?
No, this is abnormal. Okay, so this person is shifting to the right, and then they have a bend to the left. So we have a shift to the right, and then it starts to bend back to the left.
What could be the cause of this? Is the bad practices?
As I said, trauma.
Like that?
Yeah, it could be trauma. It could be a car accident, slip, fall, something like this. Or it could be, you know, like I joke around. Like I said, the Omani driving posture, right? You have a couple of different Omani drivers. You have the Omani drivers who put the chair as far back as possible and put the leg up on the dashboard, and they drive like this. You have the RF type of driver who puts it back and he sits like this, and then, you know, he can't put his head like this, so he puts his head like this. Right? And then you have the guy who has the center console, and instead of sitting straight, he sits into the center console like this and drives, right? If I sit like this all the time, I'm going to end up like that. I'm picking on you. Okay, so this is my favorite quote. I love saying this quote. Because we have to understand, again, that posture will give you pain. A bad posture will give you pain. A bad structure will give you pain. But it's more than just your pain. And I keep getting across to that point. It's more than just your pain. It's your health. So there's a research project done in 1994. And it says posture affects and moderates every physiological function from how you breathe, your breathing, to your hormonal production, obviously spinal pain, headaches, how your mood is, how you feel, right, throughout the day, your blood pressure, your pulse, your heart rate, right, and your lung capacity are among the functions most easily influenced by posture. Most easily influenced by posture. Okay, so think about that for a second. What about the other ones that are being influenced by your posture that are harder to influence with posture, right? So it's a big statement. And you know people with high blood pressure. How many people here are on high blood pressure medication? A lot. Yeah. Even if they're skinny. You see some people that are really skinny, you're like, wait, that doesn't make sense. Why is that, right? How many people have depression? You know? How many people here get headaches? How many people have racing heart rate? Their heart, blood pressure and pulse go hand in hand. Lung capacity. How many trying to go up the stairs to the offices here? Out of breath, right? One of the things is when we're bent like this, you can't get as much air. When we're standing straight, we can get a lot more air. Okay? All right, so if we find that you have bad postures, if we find that you have spinal problems, is it something that you want to fix? Okay? Okay? So here's my thing. If we see that you have postural problems from the front, okay? Traditional physiotherapy, if they give you the correct exercises, may be beneficial for this. Traditional chiropractic, probably not so much, unless you're in pain. Like if you have pain, you're standing like this, and obviously they adjust you and you get you out of pain, you'll see an improvement, okay? But unless you apply a very direct influence, exercises, very specific adjusting, you probably will not influence the posture from the front all that much. So I give credit to like the physios and the osteos who put time into some of those exercises to try to improve that, okay? However, when it comes to the structure from the side, the curvatures, traditional chiropractors, physiotherapists, osteopaths, and all the others that are out there, body workers, massage, all that stuff, cannot improve the curvature of your spine unless they're using a very specific forces over time. Machines, we have traction machines, okay? And so this is where there's a disconnect a lot of times. People go to the chiropractors and they feel better. They go to the physios and they feel better. Awesome. I'm not saying there's nothing wrong with that if your only focus is on pain. But if we're trying to improve your structure, you're going to need to do a bit more. It's the equivalency of going to the dentist. You go to a dentist, but you have crooked teeth. Did the dentist fix the crooked teeth? No, right? He cleans the teeth. You have to go to the orthodontist, a specialist, to put braces on the teeth to improve the shape of those teeth. It's the same thing, okay? Except they don't fight about each other. The dentist knows he's doing this. The orthodontist knows they do this. In our world, no, I do it too. No, I do it too. No, I do it. I say, show me the evidence, because we do. We have the evidence, okay? So the way we're going to go about fixing somebody's spine when they have problems is 3 steps: exercise, adjust, traction. Okay? It's not sitting on the ground with the rice and meat. We're not eating here, okay? How long does it take? That number scares people. 10 to 12 weeks, 3 to 5 times per week. But it's the same concept as somebody braces on their teeth. How many of you guys know people with braces? Everybody, right? How long did a person wear braces for? Some people years, some people months. Everybody's different, right? So you can't say 6 months, 1 year. We don't know. It depends on a few factors here. How old you are. That's a determining factor. The older you are, the stiffer you are. The older you are, the harder it is to change, in theory. Okay? How long the problem has been there. Now that's a big one, because just because you're older at 50 than maybe somebody at 30, if the person at 30 got the injury at 10, and the person at 50 got the injury at 45, 5 years, 20 years. That person's going to be harder to change at 30. How much damage is in the spine? That goes hand in hand with how long it's been there for. Okay? But again, typically the longer the person's had a problem, the more damage builds up in the spine. How hard you work at doing your exercises. So people come to me all the time with lower back pain, but then they also have problems in their neck. Well, guess what? Because they don't have pain in their neck, they can work a lot harder at it. They can put a lot more force into their neck. Maybe with the pain, they can't do as much down here, but they can do a lot more up here. Make sense? And then everybody has their own genetics. Okay, your mom and dad, your mom and dad's mom and dad, your mom and dad's mom and dad, mom and dad. Okay, they pass genes down to you, and everybody's genes make them uniquely different. So I've had my DNA tested myself, and my DNA suggests that I have very poor healing ability. My soft tissue, my ligaments, they don't heal well. So if I've ripped something, it takes me a very long time to heal. versus other people who may heal faster. Okay, so everybody's a bit different. All right, so here's examples of exercise adjust and traction. Go ahead. So when we have exercises, somebody has a body shift to the left. They're going to put a block against the wall, and they're going to get an exercise that's a body shift to the right. Make sense? Okay. Same thing goes for the neck. Same thing goes from the side. If a person's standing like this, they're going to get exercises to strengthen their body from the side. Adjustments. So again, if you watch YouTube videos of the people getting cracked, that's traditional chiropractic care. This is what we call CBP, or what we specialize in. Okay, these are mirror image adjustments. These are meant to reset your brain. I always say it's like hitting the reset button on a computer. When the computer stops working correctly, everybody says turn it off, turn it back on. It's working better again. Okay, same thing here. If a person's shifting, we put a block against their rib cage. It shoves them over. We apply force, and then they stand up. They're straight. Okay, for some time, and then the muscles that were strong start to take back over, but maybe not as bad as before. So every time we do it, it gets slightly better and better. And then finally, the torture chamber. Oh, no. Traction. All right, traction is designed to stretch those ligaments. This is what makes us very different from your traditional chiropractic, your traditional physiotherapist, your traditional osteopathy. Okay, the goal here is to stretch the ligaments of the spine, not the muscles, the ligaments, the arbata. We're trying to stretch and strain those ligaments to bend the spine back to where it's supposed to be, or flatten the spine out maybe, if they have too much curve. Okay? So I know it looks really uncomfortable. Some of you guys go, oh, I could never do that. That looks horrible. Yeah. Well, that might be the wrong traction for you, so don't worry about it. One, and two, you don't start like this. This is like a final position. So we would start with a very modified position and slowly over time build you into that. And then, you start on day one, you're like, man, I struggled with 15 pounds in the front. I'm at 30? Yeah, you're killing it at 30. You're just relaxed and sleeping. Okay, so your body adapts over time. Okay, so now I'm going to go over some different ergonomics, all right, to explain. These are some basic things that you guys can do to yourself now so you don't injure yourself later. Okay, so first is computers. I think most of you guys work in the office here, right? You're on the outside, so some of the stuff would be better for you, some of the stuff would be better for them. But computers, well, these chairs, and I don't know if these are the same chairs you're using upstairs. They're different? These actually aren't that bad. They're really not. The reason I say that is because you have the option to change the angle of the chair. Okay, you have the option to change up and down, and you have the option to change the arms. Okay, these aren't bad chairs. Now, when we're looking at the chairs, the arms are really important. If you have it too high, it's going to push your shoulders up, and that's uncomfortable. If you have it too low, it might drag your arms down. So you want it so you can relax at 90 degrees, nice and relaxed here. And you should use the armrest. We want the keyboard to be right in front of us, so our arms can rest on the armrest here, and then we can type. All right, some people put the keyboard out here, and now they're doing this. And then they wonder why they get neck and shoulder pain, because they're always reaching for the keyboard all day. All right? Now, of course, that happens if we're using a laptop, right? Because the keyboard's here on the laptop. And then the screen's down here, so we're doing this. So, of course, that screen needs to be higher up. So that means you take the laptop, put it on some boxes, but now the keyboard's up here. So we need a wireless keyboard. Does that make sense? Yeah. Okay. Second is the chair. The chair, you'll see the legs are at a 90-degree angle or slightly less than 90 degrees. And that's important because some people will put the chairs really low, and now their legs are above 90 degrees, and it shortens the hip muscle here, and it tucks the pelvis, so it flattens that lower back out, and that creates lower back pain. All right, so we want to raise that chair up so their legs are either 90 or slightly less than 90. So it makes you sit up straighter and puts that curve in your back. The chair backing here, this picture they have it straight at 90 degrees. You actually shouldn't be straight. You should be about 100 to 110 degrees. Okay, so something like this, like 100, 110 degrees. So we're like this. We're not completely upright. about 110 degrees. There's less pressure on your discs when you're like this. Okay. Now the only problem here is you have to be careful, and I think maybe the office chairs upstairs has the headrest that comes up here, right? Yeah, and that's good because then you can actually keep your head back to the headrest. And it's almost something you kind of got to remind yourself of, because then most people throughout the day will start to go like that. Okay? And this one doesn't even have a headrest. One thing you'll see is the foot thing here. Again, that has to do with the height of the seat, meaning I'm very tall and I have very long limbs. So when I put the seat high to get my legs like this, my feet still touch the ground. But some of you guys might put the seat up and then your feet are kind of dangling. You don't want your feet to dangle, so you can put them on like a block. So you get that real resting position.
I have that in my office.
Good.
They made it for me actually.
Good. There you go.
Provide.
Yeah. Okay. Lifting do's and don'ts. All right. So here, I'm just going to move this slightly for now. Can you bring me something to lift? I had a tissue box yesterday. I don't know where it went. The bottle's fine. Yeah. You guys, you'll get a little laugh out of this one. This is my favorite section here. All right. So obviously, lifting as a team, right? This is what you guys are told on the outside. If it's too heavy, lift as a team. Here's the problem with lifting as a team. One guy lifts correctly and one guy lifts incorrectly, right? So you have one guy going like this and we have the other guy going like this. What happens when this guy lifting incorrectly, as he's going up, he goes, oh, and he goes like this. He drops it and it goes right to that guy. Even though that guy's lifting correctly, he goes, oh, and he hurts himself. So you guys both have to lift correctly. That's one thing. 2, use your legs. You're always told to use your legs. So use your legs, you got to perform a squat. Okay? Unfortunately in Oman, I meet very, very few Omanis who know how to squat. Okay? Basically whatever I say squat, and this started in Singapore. I had one of the Omani patients that I had in Singapore. I was trying to get him to exercise. I'm like, all right, squat. He'd go. I'm like, squat. No, put your butt back. No, put your butt back. Okay? Didn't matter how many times I tried to teach him, he'd always stick his stupid knees forward. And I honestly think it's because from a very, very young age, you guys learn how to pray. And as soon as you learn how to pray, you have to go down to that kneeling position, and it's this here to pray. Okay? So it's always a forward style squat with the knees going forward. Plus, if you're in the mosque and everybody else is praying around you, you're not going to stick your butt out. Okay, that's a big no-no, right? So when we squat, we actually push our butts out and then we lower ourselves at our hips. Not at our knees, actually at our hips. And as we lower at our hips, then our knees start to bend. Okay, so we're using all our leg muscles and our butt muscles here to hold us up. We can hold that very long if we want to. It's quite, it's challenging, but it's good for the musculature. So unfortunately, when most people guys lift here, I imagine if they're trying to squat, they do this. Okay, and they try to lift like this with the knees squatting like this. The problem is, if the box is here now, your weight is very forward. Everything's very, very forward. So A, you can fall off balance very easy. And 2, the first thing you're going to do is you're going to straighten your legs. And then you're going to lift with your back anyway. And that's why so many guys have disc issues in this country. I guarantee it. So if they're squatting like this, and then also the weight is out here, so there's more weight. So now and then they have tons of weight here. Okay? So proper is, here's the item. We go over to it. We flex our hips. We stick our butt out. We lower ourselves down. Now we're under center of mass, and we lift with our legs. There is no bending whatsoever. Okay? But that takes a whole month-long class. I swear, it takes a month-long class to teach it. Okay? And then of course, turning with your legs. You pick something up. You don't just turn with your spine. You actually turn with your legs. That's a big one as well. Okay, cars. Very, very similar to your office position. Okay, when we're in the car, it's that same back position. You'll notice 100 to 110 degrees. The reason is there's less pressure on your disc at 100 to 110 degrees, not 90. Everything sitting up straight is good? It's good, but it's not the least amount of pressure, okay? The legs and hips are aligned. Again, if we can get the legs a little lower, cool. Otherwise, it's 90 degrees. We don't want those knees high up, all right? And then the arms, 9 and 3 on the wheel, and just a relaxed position. None of the whole RF driving style. Yeah, okay? And no more of this leg up on the dashboard driving style. And no more of the leaning to the side, trying to be cool gangster driving style. I don't understand it, okay? And then the other thing is the headrest. You'll notice in the old cars, it's a very flat headrest. They're very, very flat. And some of them don't even reach your head. Some of them only came to about to your neck here, right? As time went on, they did go up to your head, but still they were very flat. You'll notice today that a lot of the new cars, they're angled slightly forward and they kind of push out along the back here. And then people always lower them down, right? So they're in their neck. It's like, oh yeah, it's good for me. Okay? The problem is, it's supposed to be here. Now, the reason is there is for safety. While I don't like it myself, because it does put people forward like this, and that's not great for long periods of driving, it's meant for safety. The reason it's there is, in the older cars when there was nothing there, or very flat, you're driving, and what would happen is if you get hit from behind, your whole thoracic cage goes blah, forward first, and as we do this, our neck would snap back, and if there was nothing there to support it, it would snap all the way back, and then you rebound, you snap all the way forward, and then you snap all the way back again. And that's that whiplash they talk about. When they started doing this, it did help a little bit, so you would hit and then come in. The new cars push you forward. And what it is as it hits, it literally pushes you to here, so then your head really doesn't have anywhere to go. It goes forward and then it hits again there. So you lose a lot of that whipping sensation. That's what it's designed for. Again, not great for long periods of driving, unfortunately, but it's also there for safety. So take what you can get, I guess. All right. Getting out of bed. Now yesterday I didn't set up the table, so I figured, hey, let me set up the table and show everybody. How many people get in bed in the morning, they're sleeping, time to wake up, yeah, bad idea. Okay, but how many people do it? A lot, right? Because you're cold, you're stiff, you were sleeping all night, everything's tight, everything's short, and then you just activate everything and load everything at one time. Right? So how should we get out of bed? Well, we should turn to our sides. Okay? Then use our legs as a lever, so we drop our legs and push with our arms like this. Okay? That produces way less stress on our body, so we just turn, and then legs and arms like that. Good? Any of you guys do that?
I can't actually like this straight. When I do the straight one, I get dizzy. Is that the issue with the ball or something?
Which one?
I have to do the side one. Always.
You have to decide when you get up.
But when I just get.
That depends. That could be a blood pressure thing. Okay?
My blood pressure is low actually.
Yeah, that's what I'm saying. When you're laying down, it's even lower. Okay? And when you go from a laying position to a sitting position, now you're asking your blood pressure to rise, and yours isn't rising fast enough. And so, whoa, all the blood comes out of your head, and then you start to get really, really dizzy. Okay? And then everybody's biggest question that I get in the clinic is the pillow. What pillow should I use? Doctor, what pillow should I use? Doctor, what pillow should I use? I hear that question so many times. And so I brought some pillows today to show you guys. Okay? Now, the gray one there, or can you yep. Okay. This is actually my personal design. Okay, I personally designed this one. I had this, long story short, I made a batch in the UAE. That was really good, but they were very expensive. I moved it to Oman, to Sohar mattress, but they were very unreasonable Sohar mattress with how many they wanted me to produce. So then I went to China, of course, and then China produced me some sample sizes. However, to put this in production was going to cost me an extreme amount of money, so it's not in production. Okay, but this is only one size. There are 4 sizes to this pillow, so I'll go over what this pillow is doing. And then those two are different options. This one you'll see actually, okay. This one I'll explain to you. It's pretty decent. This is sold out of America. It's called the Proper Pillow, okay. And then this one is one I bought out of China. It's pretty nice, but again, one size fits all, unfortunately. But you guys are welcome to try them if you want, okay? And then there's another one I just found in China that I really like, but I haven't purchased it yet to trial it out. So I'm basically trying to find a company who makes a good pillow that I can just sell instead of trying to make. That's what I'm trying to find. But when we're looking at different pillows, most people obviously sleep on a regular pillow. And when they sleep on a regular pillow, some people like it really high, some people really like it low. But all of them are no good if you're on your back, okay? Because what it's doing is it's putting your ear in front of your shoulder. And so it cranes your neck forward. Like that picture we saw, okay, it's doing that for 8 hours while you're sleeping, and it's creating a lot of muscle strain and stress and also disc stress. So people wake up, yeah, I just slept funny. I'm like, no, you actually slept normal on your pillow, but it was just bad. It's not a good position to be in. That same pillow that's big on the side may be too big and then takes the person's head and bends it to the side, okay? So some people opt and they say, well, I'll sleep on something low. Well, they sleep on something low and then their neck cranes to the other side. Then people go to the pharmacy and say, well, I'll just buy that cervical curve pillow that everybody's talking about. And they buy those, and I have x-rays on those, and those are horrible. They actually are just as bad as the regular pillow. Because while you're on it, your ear still ends up in front of your shoulder. And it just struts your neck forward. Even though there's a bend here, it's supposed to bend your neck, it doesn't. It still just shoves your head forward. Okay? So this is an x-ray of somebody on a regular pillow. So this is the front of their face, this is the back of their head. We're supposed to have a curve that starts from here and goes this way. But you're sleeping like this for 8 hours. You can imagine the amount of stress and strain that's on that disc down here. Make sense? Okay. So this is the same person. Now they're laying with nothing. There's no pillow. There's nothing underneath their neck. So their head is on the bed, their shoulders are on the bed, and now their neck bends in the wrong direction because there's nothing supporting their neck. Okay. So the best pillow to use, I always tell people before I was trying to find something, was a towel. You take a towel, you roll it up, and then you put that in your neck because that's giving you the optimal or ideal support of the neck. The head is on the mattress, the shoulders are on the mattress, and the neck is just supported. But then the question is, what happens when I turn on my side? And I used to always say, and that's the same, everybody says, well, what happens when I turn on my side? I said, yeah, that's the problem. You need to grab your pillow and take that out and put your regular pillow there, and that pillow should support you from shoulder height to chest. So your head stays straight. So this girl, right, we could draw a line from the center of her skull, nose, chin, neck, and she's very, very straight. Her neck is very, very straight. Now the cervical curve pillows, I never understood those. Yeah, they're great for you. So you get that bend in your neck when you're on your back. But when you lay on your side, they say it makes you straight. Wait, so it bends your neck on your back, but when you lay on your side, we're not getting a bend? No, it's fine, you're straight. Okay? Obviously that makes 0 sense whatsoever. So again, the curve pillows were great for somebody on their back, but when they turned on their side, they end up like this. So the ideal pillow would be somewhere in between, right? Where we have a supporting structure for the neck, and then when they turn on their side, a pillow on the side is flat. We're not getting anything there. Okay? So that's the ideal pillow. This is the cheap version of it. A towel folded and a regular pillow. If you want to go throughout the night sleeping on your back like this and changing it to the side when you go on your side to a regular pillow, and then if you go back on your back, putting it as a towel, and then going back on your side and putting it as this, that's your choice. That's up to you. Okay? Or you could try to find something similar. Now, this pillow here from America is similar to my pillow in the fact that it's a hole in the center here. There's nothing here, and then you have this. The problem with this pillow was it was one size fits all. And they said if you want to make it higher, you shove like some towels underneath it to lift it. What? How much do you want me to pay for this? And you want me to shove some towels underneath it to make it proper? Okay. And then the center here, because it is covered, it still gives you like a lift. So it kind of still lifted your head a little bit. Now, I took some x-rays on this pillow. It does a decent job. It's not fantastic, but it does a decent job. It's definitely better than a regular pillow, and it's definitely better than something you'll buy in the pharmacy. Okay? This pillow here, oh, sorry. This pillow here, I don't have here anymore. It's called the Headrest pillow. I'll show it to you. Sorry. This pillow. It's called the Headrest pillow. You can buy that online, headrest.com, okay, if you wanted. It's about $100 US. But it's a tube, and then it has these little mattresses on the side. It looks like a telephone. That's what it looks like. All right, it's really ugly. My wife is like, I don't want that on my bed. It's ugly. It's ugly. Get it off my bed. Okay. So one thing, the ladies won't like it. They'll want to throw it in the closet. Okay. Second, it's one size fits all. Again, I don't like that concept. And third, it's very soft. So if you're a very small person, like a lot of my Singaporean patients who are very tiny, hey, that's fantastic. Hey, use this. It's great. And some of the patients who got them, because I got a couple for people to try, oh, I love it. I laid on it. I smushed it in half. It did nothing to support my neck. And when I laid on my side, it was about this too small, so my whole neck would slide to the side anyway. So it's not a great pillow on the side, in my opinion. So that's an option though. And the concept was there. It's a little older, but the concept was there. Same thing. We get that ball, and we have the side pieces here. This is a pretty decent one. I made this. My pillow, does not one size fits all, it's 4 sizes. Okay? And every single one I tested on it, it beat every pillow I tested it against. So I know this is the better design. So what can I do? Can I find something similar to that? Well, I kind of have. I found a pillow, like I said, in China. I'll buy it now and see. This is another one that I found. I really like this one as well. I thought, hey, this is pretty cool. What this has is, again, the side pieces. And then here in the center, there's a pump. Okay, so we're blowing up the neck here. Now this is super soft, so your head just kind of collapses here. So again, it's holding that neck here, and then when you lay on your side, you're getting that. Now the other thing it does have, it has a plug here. I didn't bring the attachment to it, but you plug this into the wall, and then you turn it on, and it has heat and vibration. Don't really think you need that part of it, but if you wanted it, it's a little added feature. Okay, so again, you guys are more welcome to try them and see if you like any of them, play with them. All right. So this is the Headrest pillow. So when the person's laying on the Headrest pillow, we get that support of the arc. Okay, but again, this is one size fits all. So how tall is this person? What does this person look like? Because my neck didn't do that. All right. So quickly, just a quick case study. I fly through this so you can see some of the results that we can get in our clinic. This was a doctor who came to our clinic. She had really, really bad lower back pain. She had pain for about 10 years. But in the last 7 months before she came, the pain increased drastically. She had an MRI done in 2007. This is about 2014, so 7 years ago, the MRI. And it showed a mild disc at L4-L5 and a bigger disc at L5-S1. So you figure 7 years go by, and it's probably a little bit worse than that, okay? Or much worse than that. The good thing here, or the interesting thing here, was she did have previous regular chiropractic, regular physical therapy, regular osteopathy care. It would help, but only for about 24 hours. Okay? So we're going to go over her x-rays really fast, and here green is normal and red is her. All right, so we can clearly see here that that doesn't look so great, and this is her neck. Remember, no neck pain, all lower back pain. Okay? From the front. Okay, same thing. Red is her, green is normal. Red is her, green is normal. So it's very flat at the top here. And this is looking at her from the side. And then from the front, we can see that big distortion of her body. So she's shifted and she's bent on the outside. Okay, lower back, very, very flat. There's no curve in here. From the front, very, very shifted out to the side. Okay, so we took her through chiropractic adjusting, the traditional style, plus the mirror image that I showed you earlier. We took her through exercises, the mirror image, and we use whole body vibration in our clinic. Decompression, it's not something I talked about, but you'll see this. This is all throughout Oman. There's a lot of clinics that do this. Traditional physiotherapy clinics, even some of the chiropractic clinics I think have this as well now. And it's meant for a disc. It's always 1 + 1 = 2 for these clinics. You walk in, I have lower back pain. I have an MRI. I have a disc. Okay, disc. 1. Decompression, 2. 1 plus 1 equals 2, okay? Meaning disc problem, this helps my disc problem, that's gonna get the benefit of the disc problem. Doesn't work that way, unfortunately, but you'll see that type of table, and we use it in our clinic when people do have discs, but a lot of times, just like this lady here, she was very flat in that lower back. So there's no curve in this lower back. So if I put her on one of those decomp tables and I pull, I'm only making it straighter. Okay, I'm not benefiting her by putting a curve in here. I'm only making it straighter. Okay, so obviously the third part is that traction. This is where we're trying to bend the spine, trying to bend that curve, trying to put the weight back on the joints like it's supposed to sit. So this was her post-care. So post-care, basically all her pain went away. She was pretty good. The 12-week course of care that we wanted her to do, she did in about 18. So she was it took a little longer than normal, but she got through it pretty good. She was doing home care 2 times a week. Almost all the pain went away and was holding steady after 2 months. So without seeing us for 2 months, she was still feeling really, really good. Okay, so again, regular chiropractic care, regular physical therapy, regular osteopathy didn't give her that relief for any less than 24 hours. We make it go away, and it stayed away even checking her later. Pre, post. Is it perfect? No. Is it better? Yes. All right, so before and after. Okay? Before and after. Nice. Before, very flat. After, starting to bend. Is it perfect? No. Does she need more work? Yes. The curve actually went from a 9-degree curve to a 24-degree curve. Here, normal would be 37. We're heading in the right direction. A lot better. Before, after. Yay. Okay, obviously, when she was here, she also had a lot of pain. So this is a very painful posture, and as the pain started to go away, she started to creep out of that as well.
How many sessions she did?
40 visits. 40. Okay. And then lower back. Again, is it perfect? No. Does it need more work? Yes. Okay, but the idea was we're taking the weight off of this disc and putting it back onto the joint. Okay, and on top of that, she did have a fracture here. It's very hard to see here, but on here you can actually see this bone fractured. So at some point she had slipped and fallen pretty hard. And when she did that, that bone came and smacked the front of that bone and chipped it. Okay? And then pre and post. Good. Okay? So this person obviously is not done. She needed more care after this, but a good start to where she started at. So that's all I have for you guys. If you guys have any questions, feel free to ask. I know we asked some in the beginning. Ask some more questions if you want. If you want me to do posture evaluations, I can. If you want me to do further palpation check or anything like that, we have a table in the back here. You guys can play with the pillows, see what they feel like. The one I brought's a medium, so it should be okay for most of you guys. Okay. Any questions?